Welcome, everyone. We're gonna just start off with instructions on how to use the interpretation feature for this webinar. So I will pass it to Aldo, who's joining us today from Algarvia Interpretation.
Good morning, good afternoon. I will be giving this announcement both in Spanish and English. Buenos días, buenas tardes. Daré este anuncio en español y en inglés. My name is Aldo, pronounced they, them, and I'm part of Algarabia Language Cooperative, and today I will be providing simultaneous Spanish-English interpretation. Mi nombre es Aldo Reséndiz, pronombres ella, le, y el día de hoy voy a proveer interpretación simultánea al español y al inglés. We're going to ask all participants to please speak at a moderate pace, like I'm doing right now, and loudly and clearly into your microphones to make interpretation easier. Le vamos a pedir a todas las y los participantes que por favor hablen a un ritmo moderado, como lo estoy haciendo yo ahora, y en voz alta y clara en sus micrófonos para facilitar la interpretación. We have already activated the interpretation function in Zoom, so you should be able to see a globe icon at the bottom of your screen. To listen to the interpretation, click on the globe and select your language of choice. In this case, it might be English. If you're joining us on your smartphone or tablet, click on the three dots at the bottom right, where it says More, select Language Interpretation, select your language, and then click where it says Done, so you can start listening to the interpretation into English when someone speaks Spanish in the space. Ya hemos activado la interpretación a través de Zoom, así que si usted se conecta desde la computadora podrá ver el icono de un globo terráqueo en la parte inferior de la pantalla. Para acceder a la interpretación, dele clic en el circulito, en el globo, y seleccione su idioma, en este caso puede ser el español. Y por último, dele clic en finalizado. Si se conecta desde su teléfono inteligente o tableta, va a haber tres puntitos que están en la parte inferior a mano derecha, donde dice más. Seleccione interpretación de idiomas, seleccione español. Y por último, dele clic en finalizado para que escuche la interpretación al español cuando alguien hable inglés en el espacio. We ask everyone who is not fully bilingual to please turn on the interpretation, but if you are someone who is bilingual, you don't have to turn it on. And if you have any questions, please feel free to write in the chat. Thank you, and I'll finish in Spanish. Le vamos a pedir a todas las personas que no dominan ambos idiomas que por favor enciendan la interpretación, pero si usted es una persona bilingüe, no necesita encenderla. Si tiene alguna pregunta o algún problema para conectarse a la interpretación, por favor escribe en el chat para que alguien pueda asistirle. Gracias y que tenga una excelente sesión. Thank you.
Thank you. And we ask if anyone is having trouble with their interpretation to just please put so in the chat. And we have some Women's Voices of the Earth staff that are also on the call that will be more than happy to help everyone figure it out. But welcome. Welcome today. We are doing our Cleaning Products one-on-one webinar. For those of you who have attended any of our one-on-ones or events before, welcome back. For those of you who are joining us for the first time, it's great to have you. Whether you are new or returning, please feel free to introduce yourself in the chat. Say where you're from, where you're calling in from, an organization that you're associated with. Anything is welcome. A little bit about Women's Voices for the Earth. So our mission is working towards a future where toxic chemicals are no longer harming our communities. And so we focus on this through an intersect of a couple of different ways, through research, advocacy, and organizing, and pushing to make intersectional change rooted in solidarity. And so that's the grander mission of our organization. Today, we're going to be specifically talking about cleaning products. But before we get into that, I would also like to do a land acknowledgement. Next slide, please. So Women's Voices for the Earth, which we will also refer to throughout this presentation as WEAVE, is a national organization, but we are based in Denver, Colorado. And our office specifically is located somewhere in Denver that operates on unjustly taken indigenous tribal nations that we refer to today as Nichu, Shoshone, Apache, Arapaho, and Cheyenne peoples. And so if you're interested in doing a land acknowledgement during this presentation, we do encourage you to do so, and we will enter a link in the chat where you can figure out on what land you're occupying. Next slide. My name is Jayla Burton. I use she, her pronouns. I am the Director of Programs at Women's Voices for the Earth, and I am calling in from the San Francisco Bay Area on Ohlone land, and I will pass it on to Alexandra Scranton, who will be helping me co-facilitate. If you'd like to introduce yourself, go ahead, Alex.
Sure. Hi, everyone. I'm Alexandra Scranton. I'm the Director of Science and Research here at Women's Voices for the Earth. Just great to see all these attendees today, and yeah, looking forward to it.
Awesome. Next slide. In today's webinar, we are going to be covering the basis of what cleaning products are, what communities are disproportionately impacted, what chemicals to watch out for, and then most importantly, what are the actions that you can make to make a difference. And we'll go to the next slide. So before we get into this deeper conversation, want to open it up for conversation. But when you hear the term cleaning products, what is the first thing that comes to mind? So feel free to share your thoughts in the chat. We have Chandra, I hope I'm pronouncing that right, saying chemicals, toxics, bleach. Yes, these are all things that we're going to talk about today. Awesome.
These are great. Yeah.
Yes. Okay. Next slide. So yes, you all are on par with everything. A lot of the chemicals that have been mentioned in the chat, a lot of the products that have been mentioned in the chat are just a few of the cleaning products. And what we want to name is that cleaning is very essential for our daily lives and has both physical and psychological benefits, but it's also important to remember that they can also pose health risk as well. So many of the chemicals found in these products can be hazardous or cause negative impacts on our health, which we will be talking about throughout the duration of this webinar. And we could go to the next slide, which is another question. We're getting started in a very engaging way with all of you. But the next question I'm going to pose in the chat is, who do you think uses the most cleaning products overall? Deborah says, my mom. Yes, think about this like very interpersonally, the people in your community, systems wise as well. I see someone saying hospitals, domestic workers, schools. Exactly. These are all communities in which cleaning products are used. Women. Awesome. Great. If you want to go to the next slide. So you guys are on par again. Most of the folks that we're going to be talking about who are disproportionately impacted by the harms of chemicals found in cleaning products are going to be low-income communities, communities of color, and women as well. And next slide. So specifically speaking about low-income communities, the main challenge here is that access to eco-friendly cleaning products can be quite expensive. And so as folks are considering being more financially aware, like budget constraints could lead low-income individuals to choose affordable options that might be affordable, but might not always be safe. And so this can result in like buying cleaning products from Dollar Generals, Dollar Trees, and those cleaning products are often likely to have more increased additives of fragrance as well, which we'll talk about that a little bit throughout this webinar also. And then addition to not only looking at the chemicals that make up some of the cleaning products, but many low-income communities are also living and placed closer to toxic waste sites or chemical facilities, which also increases environmental pollutants for these communities as well. Next slide. When speaking about this from a gender justice perspective, and before I get into the meat of this slide, I just wanted to do a disclaimer that this is, I'm going to be sharing data that primarily pertains to cisgender women, as there's limited research available on cleaning products and exposure amongst individuals with other gender identities that may exist in the femme or non-binary spheres. So the weight of the evidence shows that women do have higher levels of exposure to toxic chemicals from cleaning products. Despite all of the change that we've had in our world, gender norms still do exist to a certain extent. And there's about 70% of women that are still doing household chores. The Economic Policy Institute reported that 95% of housekeepers are women as well. And then when looking at market research, about 90% of cleaning products are purchased, or those purchasing decisions are made by women. So those are important things to take into consideration as well. Additionally, we also look at the health impacts on reproductive health as well. So for example, chemicals like phthalates, which can be found in fragrance cleaning products, can be linked to endocrine disrupting and hormone disrupting chemicals that can cause a lot of reproductive issues for women identifying persons. Next slide, please. Speaking more with communities of color that are disproportionately impacted by cleaning products. As mentioned in the previous slide, when we're talking about occupation, like we have, for example, in this slide, it shows that 60% of house cleaners in the US are Latinx, and in certain regions that rate could be even higher. Like for example, in California, there's an 87%, and that compares to 6% of house cleaners are African-American or Black. There was a study done in the state of New York that found that 60% of Latinx car wash workers link their health issues, for example, shortness of breath, skin rashes, and headaches to exposures in the cleaning products that they were using at their job site. So that is another really important thing that we would like to raise to the surface as well. Next slide. And I think this is something, a really important mention is that our corporations know these statistics and this data as well, and they capitalize off of them sometimes. For example, the Latinx buying power is pretty large. So in a course of a year, there's about $1.5 trillion of money that is going into the cleaning industry, and a lot of that is coming from the Latinx population. And there are specifically targeted brands such as Fabulosa that have been heavily marketed historically to the Latinx community. And that's to mention there's, and I'm not sure if it's on their website anymore, that there was an Our Story campaign that done by Fabulosa, which kind of linked like the generational use of Fabulosa and the importance of using the cleaning product very intergenerationally as well. And so that kind of shows how deeply ingrained that the cleaning industry is within these certain communities also. And then next slide. And then that brings me to scented cleaning products, which is, I think, a great way to kind of wrap on a bow when we talk about the disproportionate exposures that exist between communities of colors. And when I say community of colors, I'm meaning Asian communities, Black communities, Hispanic, Latinx communities as well. There has been this notion that what is this idea of clean, right? And it needs to smell good. And so there's I think a lot of the disproportionate impacts are happening at the intersect of racism, sexism, and classism. And what we really need to do is like kind of debunk some of the myths behind cleaning and fragrance. So for example, fragrance does not enhance cleaning power. Just because something smells like lavender or lemon or tree drops or whatever it may be, it does not mean that is going to kill germs at a higher rate, right? And there's also can be a lot of, and Alex will talk about this more in her portion of the webinar as well. But for example, lilial, which is a reproductive toxicant that can be found in fragrance products. Over the years, we have found that it is becoming more common with pressure from consumers and state policies as well that are really calling for corporations to disclose the ingredients that they're putting in their cleaning products and specifically in fragrance. So we are seeing an uptick of that, but overall there's a lot more that needs to be done. And we'll kind of talk a little bit more later on about what it is that we can do collectively, individually to kind of take power. But I'm going to pass it on to Alex so that we can get into the really fun portion of the webinar, which is understanding a little bit more about the science and how the science interacts with our bodies and how it might cause some health concerns. So I'll pass it on to you, Alex.
Terrific. Thank you, Jayla. So yeah, let's go to the next slide. So yeah, let's get into it. We're going to be talking about toxic chemicals that we know are in cleaning products today. This webinar will not cover everything, like every toxic chemical in every product that's out there. There are probably too many, but we're really concentrating on these 5 categories: disinfectants, preservatives, fragrance, corrosive chemicals, and solvents. These are the ones that we find most commonly in cleaning products, as well as being problematic to health. And the reason that we call these chemicals toxic, I'm going to frame it in this way, is that they can either cause acute health effects, and these are things like allergic reactions, rashes, kind of immediate eye, skin, and lung irritation, the things that happen as you're using or right after you've used a cleaning product. Or they're toxic because they can increase risk of chronic health effects. These are long-term effects, things like asthma, COPD, which is chronic obstructive pulmonary disease, fertility problems, birth defects, cancer, that sort of thing. Obviously, much harder to connect the connection of your exposure to cleaning products to these effects, although some studies have done this. And obviously, these involve serious lifelong impacts on your health. Okay, let's go to the next slide. We will start with disinfectants. Now, to explain, disinfecting is different than cleaning. These terms often get used kind of interchangeably, but they really involve different products, different chemical ingredients, and they have different goals. So starting with cleaning is generally using less harsh ingredients, kind of soaps and detergents, but the goal is to remove dirt and grime. And in the process of doing that, you're often removing bacteria, germs, and viruses from surfaces or your clothing or whatever you're cleaning. Disinfecting, on the other hand, this involves products with an active ingredient that has been registered with the EPA as a pesticide, right? These are ingredients designed and tested to kill things like bacteria and germs and viruses. And this simple fact makes these chemicals inherently more toxic, right? Anything designed to kill things is going to have unintended consequences. Now, these products were largely developed for hospital situations, right? Where you have a lot of sick and vulnerable patients. You have very invasive procedures like surgeries where you're kind of opening bodies up, and where the risk of infection and the implications of infection are really, really high, just much higher than in everyday life. And for these hospital situations, cleaning and disinfecting protocols have no doubt, prevented a lot of harm, saved a lot of lives. But over time, there's been this, sort of marketing and encouragement to use these disinfectants in our homes as well, with the idea that they're going to somehow protect our health, keep us healthier at home as well. The problem is there just really isn't any compelling evidence that it works. Using disinfectants doesn't really make you at home, doesn't make you any healthier, but there is the risk that that poses more harm than it's actually giving you a benefit. Now, don't get me wrong, cleaning is great, and you're getting rid of dirt and grime, having a clean house, definitely good for your health. But the disinfecting part at home may not actually be helping you at all. The caveat to that is that there may be certain situations where disinfecting can be called for. So an example is if you have a sick person, active sick person in your house, an active case of COVID, flu, norovirus, doing some disinfecting may help reduce the spread of that illness in your household. Of course, washing your hands even better, but disinfecting is sometimes called for. We want to think of disinfectants as kind of like using the big guns. Just when it's called for in those extreme situations, that's when you pull out the disinfectants. The other time when it may be called for is if you have a person in your household who is immunocompromised. This means their immune system is weak, either due to illness or to effects of a treatment. And that's where even minor exposure to germs that anyone else might be able to handle could cause an infection with very serious consequences. And this is kind of when your household is kind of operating more on hospital sanitation rules. So you still have to be careful about exposure to those disinfectants, but they may be called for. But overall, there's really no evidence showing that regular household use just for sort of, weekly cleaning, daily cleaning, using disinfectants, not beneficial. Let's go to the next slide. Okay, so we're going to talk about two specific kinds of disinfectants today, quats and chlorine bleach. There are a bunch of others, but these are kind of two of the most popular ones, ones you find in a lot of products. I'll start with quats, which are called quaternary ammonium compounds. These all have very long chemical names, usually ending in kind of onium chloride. That's kind of the tip-off. You'll see these long names with these percentages in there, like 50% C14, 20% C12. That usually indicates that it's a quat, and it'll be right on the front label of a disinfectant product. These quats are very serious skin irritants. They really rip up your skin. You shouldn't have skin exposure. Commonly found in things like disinfectant wipes. And what most people don't realize, if you look at the fine print, it usually tells you on the package that it recommends you wash your hands after you use a wipe, because they know you don't want these quats on your skin, but they're putting them in a product that's very clearly going to get these chemicals on your skin. They're also potent lung irritants, so disinfectants that are in spray form are a problem because you can inhale them. Long-term exposure to people working with quats has been linked to asthma and COPD. They are associated with reproductive harm as well. Now, this was actually discovered accidentally. There were researchers doing studies on mice, and suddenly they found that none of their mice could get pregnant. The control or the experimental, none of them were getting pregnant. Their cages had been cleaned with a quat-based cleaner. And it took a while of figuring out what was going on to realize when the cages were cleaned with quats, none of the mice could get pregnant, which is really kind of alarming. They've done more studies sort of intentionally now to see about these effects. They're finding in the mice that can get pregnant much higher risks of birth defects associated with quat exposure. We still don't know if this is happening in humans. The research has never been done, right? And it's certainly a concern. There are a lot of women, particularly out there of reproductive age, who are pregnant, who are exposed to quats all the time, being told these are, keeping their households and families healthy. It's something we really need to stop using. The last sort of feature of quats I wanted to mention is superbugs. These are antimicrobial resistant bacteria and viruses that they gain this antimicrobial resistance from exposure to quats, meaning if you get infected with one of these superbugs, very, very difficult to treat these kinds of infections. It's causing this greater problem out there that we don't need. So the second one I want to talk about is chlorine bleach, probably much more familiar to most of us than quats are. And people seem to know, that it's, especially in concentrated form, it's very strong stuff. It's incredibly corrosive. It leads to these chemical skin burns. If you have spills, it can cause eye damage, even blindness, lung irritation. If you've ever breathed in kind of around a chlorine bleach cleaner, it's really pretty unpleasant. The rates of calls to poison control during the pandemic, when suddenly everyone was using bleach, were just skyrocketed. I mean, there were a lot of accidents associated, enough, for people to call poison control because they were worried about the exposures. It's simply dangerous stuff to have around, particularly in the concentrated form. So the overall tip here is really you want to rethink your use of disinfectants, particularly at home. You want to use them sparingly, use them very carefully. They're the big guns, and regular use just has little benefit, but plenty of opportunity for harm. Okay, let's go to the next slide. So now we'll talk about preservatives, and these again have long, complicated names. These are isothiazolinone preservatives. I will talk about them as MI, MCI, and BIT. Kind of similar to the disinfectants we were just talking about. These are chemicals designed to kill stuff. In this case, they tend to be a little milder because they're not intending to kill germs or mold on a surface, but rather in the product itself, right? These are preserving the products, giving them long shelf life. Anything that is liquid or kind of moist wipes will grow mold or bacteria if you just leave it alone. It needs a preservative to keep it from doing that. The problem with these particular preservatives that we find very commonly in cleaning products is that they are potent skin allergens and sensitizers. So MI and MCI, this is like the story that's been happened in Europe first when they first came on the market. Suddenly the dermatology community was saying, what is happening? Suddenly all of our patients are allergic to this, MI and MCI, just absolutely skyrocketed allergies, an epidemic of allergic reactions to these chemicals. And then it started in the US a little bit later than in the US, where these rates started to increase. The EU took action. They actually banned MI and MCI from products. And literally within a few years, the rates of allergy dropped dramatically. I mean, tremendous public health success. Right now in the US, the rates of allergy are about 3 to 4 times higher than they are in Europe because they're still legal here. We really need to change this. We know how to do it. We have such good evidence from other countries. A good tip for avoiding these, I mean, you can certainly look for these names and avoid products that contain them. But another method is looking for dry and solid cleaning products rather than liquid or moist ones. So solid bar soap, there's bar dish soap, powdered laundry detergent, powdered dishwasher detergent. If it's powdered and it's dry, it doesn't need a preservative. It doesn't need that for shelf life because there's no moisture in it for this bacteria to grow. So might be different than you often use, but certainly worth a try because it just avoids the category of preservatives altogether. Okay, next slide. Okay, fragrances, and thank you, Jayla, for teeing this one up. Fragrances is a big one. It's a huge category. So many cleaning products are loaded with fragrance, and it's largely a marketing thing, right? It really gets into our subconscious and our sort of psychology of what we think smells clean. I saw some great comments in the chat earlier that clean doesn't smell like anything, which is really very true. But we've got this psychology that we need it to smell like lemon or whatever, which is very real, and it's very hard to get rid of as well, but it's worth rethinking. Unfortunately, well, there are some people who really love fragrances and love kind of a dose of aroma while they clean. Unfortunately, fragrance has some real downsides. Fragrance these days predominantly made from petrochemicals, designed to smell nice, but which have serious impacts on our health. For one, fragrance in general can be a trigger for migraines and headaches. Different folks have very different tolerances to this. And if you think about those who are chemically sensitive, fragrance is a real problem, a real barrier to being out in the world. It's really, really hard to avoid. I mean, you can try and avoid it yourself, but it's really hard to avoid if other people are using fragrance products. It's something that needs, a lot more research and a lot more attention so we can better understand it. I want to call out some specific fragrance chemicals here that I think are especially harmful that we want to avoid, but there is certainly for some folks, any fragrance can be a real problem. The tricky thing, as Jayla mentioned earlier, fragrance chemicals aren't always disclosed. It's not always easy to find out if your fragrance product has one of these chemicals in it. Definitely worth asking manufacturers if they use these chemicals. They shouldn't be. They need to hear, from you that these are a concern. So I'll kind of go through them one by one. Lilial is the first, also known as butylphenyl methylpropanol, the long chemical name, but that's what you'll sometimes see on a label. It's very commonly used. It's banned in Europe because of reproductive harm. I want you to remember the name of this chemical. You will be hearing more from Weave about it in the coming year. It really needs more attention than it's gotten. The fragrance industry has literally known for decades that it caused reproductive harm from animal studies. They did that research themselves. They kept it confidential. They kept it buried and internally decided that this was not relevant, to human harms without letting anyone else know about it. The research, of course, some of this has come out, and now it is banned in the European Union from being used, still legal here in the US. The research really still hasn't been done on what it does to humans. We know what it does, to sort of mice and rats and dogs and rabbits and all kinds, but we don't know what it's doing to humans. We do know from biomonitoring, we all have Lilial in our bodies, something like 90% of us, you will find it in your body. And it will actually be banned from cosmetics in California, thanks to a new law in 2027. So there is some attention it's getting in the US, but of course, cleaning products, it is still widely used and will still be legal unless we can change that. Okay, so next up is DEP, or diethyl phthalate. You may have heard of, please slow down for interpretation. I get so excited about this stuff. And I apologize. I will slow down. Really appreciate Al doing interpretation for us. Okay. The next chemical is DEP, which is diethyl phthalate. This is a chemical you may have heard of phthalates before, very commonly reproductive toxicants. DEP was considered by industry as the safe phthalate. This, does not bear out to be true. It is less toxic than some of its other phthalate friends, but more and more research is coming out. It's particularly harmful to sperm count, for instance. It's just not safe. We should not be using it anymore. And one we've found in cleaners, and it needs to come out. The next two ingredients I'll talk about together, galaxolide and otany, and I won't read the long chemical names. These are both very persistent chemicals, meaning they don't break down in water, they don't break down in sunshine, they last for a long time. In cleaning products, it's a real problem. Cleaning products are always eventually going to go down the drain, right? So these chemicals get into our water system and they stick around, literally contaminating water all over our planet. Now, when scientists have gone to look for these things, almost anywhere they look, they will find them. I've seen studies in mangrove swamps, coastal waters and sediment rivers, glacial lakes way up in the mountains. You will find detectable levels of galaxolide and otany in all of these places because these chemicals are so persistent. Turns out they're also really toxic to fish and aquatic life. So it's a problem to have them in our water. We don't need our water smelling like fragrance. We need to stop using these and putting them down our drain. And then the last one I'll call HIC. Again, it's got the long chemical name you see there. It is a potent skin allergen, similar to the preservatives I was talking about earlier. It's an epidemic of allergies to this chemical. We don't need to be using this anymore. There are better alternatives. And then while we're on this slide, there's one thing, it didn't make it on my slide. But we've had some really helpful comments from some folks coming up to this webinar, and I think in the chat I've seen as well to mention essential oils. Now, essential oils often are considered as alternatives to fragrance, and there's kind of a myth that essential oils, because they're natural, because they're based on plants, that they're therefore harmless. This is not true. Essential oils are very, very concentrated. They can be very, very potent, need to be used with extreme caution. Some of these are distilled with very harsh solvents. Some of them are steam distilled, which is better. Still, it's problematic. It's very hard to find out how these essential oils are made, and we don't have a lot of research on how they are impacting folks. So, and again, for folks who are really sensitive to fragrance, any kind of fragrance, whether it's essential oil or synthetic, can really be a problem. Our best advice here is really consider fragrance-free cleaning products. Look, these are more available than ever. If your brand doesn't offer a fragrance-free version, ask them to. They need to know that this is an issue. And obviously, if you get a fragrance-free scented products, you can avoid all of these potential risks. And it can be better for the other people around you who are also trying to avoid fragrance. Okay, let's go to the next slide. Okay, so corrosive chemicals. I sort of feel like this one, it's just a quick mention because I think they tend to be more obvious as dangerous chemicals. Things like sodium hydroxide, which is lye, potassium hydroxide, sulfuric acid. You find these in oven cleaners and drain cleaners. They are dangerous chemicals, right? They can cause skin burns, they can cause permanent eye damage, they can cause lung irritation. They are overly potent because they're designed to sort of work quickly. They're designed to get, baked on grease in an oven, kind of get it off in like 5 minutes. It can, dissolve a clogged drain in a very short period of time. And we get kind of complacent. You sort of figure, well, I can find it on the grocery store shelf. How dangerous can it be, right? Don't become complacent. These are very serious chemicals. If you can avoid using these products entirely, please do so. Encourage you to snake out your drain instead of using a chemical drain cleaner. You can use a baking soda paste on an oven. Like, you'll have to leave it overnight. It's not going to be the 5-minute solution, but it means you can avoid potential exposures to these chemicals. Anytime you see a danger warning on a cleaning product, really heed that warning. If for some reason you have to use a product like this, read the safety instructions, make sure you have gloves, eye protection, open your windows to ensure good ventilation. These are really not to be trifled with, very serious chemicals. Next slide, please. Okay, this is our last category of ingredients, solvents. These are chemicals called glycol ethers. They tend to be in kind of carpet spot cleaners tend to have these, as well as some glass cleaners, particularly janitorial or institutional glass cleaners tend to have these more often. What they've found with these chemicals, particularly, they've done studies in women who clean for a living who've been exposed to these solvents, finding that when they're exposed during pregnancy, their kids are more likely to have problems affecting their brain development, things like lower IQ, increased risk of behavioral problems like ADHD, attention deficit disorder. It's really just not worth the risk for what they do. We have better ways to dissolve grease and grime. We need to be avoiding and just getting rid of these chemicals as well. Okay, next slide. Okay. So there isn't a ton of research that's been done out there on what happens to human health when you use cleaning products. There is some, and I've given some examples on this slide. This is just a handful of them. These should give us pause, right? Especially in contrast to what you hear, in kind of marketing, that these products are all good for you and, and good for your health. Most of the research we have comes from cleaning workers. There's really I'm just giving a few examples here, but there is a lot. Women who clean for a living, for example, have a higher risk of lung cancer higher risk of asthma, higher risk of skin allergies due to the work that they are doing. This is not fair. We need better products for these people to be working with. There is some research as well, not as much, but some looking at what happens when you use cleaning products at home. There's a few things that, the studies have looked particularly at vulnerable populations like pregnant women. So use of cleaning sprays, air fresheners, solvents, these are all things that get into the air, right? During pregnancy, this is increasing risks of respiratory infections in the children once they are born, right? So it's doing something to their lungs during that prenatal period. Similarly, disinfectant use during pregnancy, we're seeing increases in asthma and eczema in children of those moms. And then, and aside from pregnancy, just for anyone, there was one study finding that weekly use of household sprays and disinfectant wipes, kind of doing that regular disinfecting that I was talking about before, is increasing the risk of asthma, at least found in this one study. So again, it's a handful of research kind of here and there, but it really does give us pause. And again, I don't want to imply that, the take home is not like, let your house get dirty, right? Cleanliness is a good thing. There's no doubt getting rid of dirt and dust. It's good for your health. It's good for your mental health. We just need to be smarter about the products we use to achieve that cleanliness. Okay, let's go to the next slide. Okay. So all of this, I think, begs the question, why are we still using these toxic chemicals in cleaning products? We do know this. We have some research. We know about the harms of these chemicals. Why are we still doing this? Now, few of these toxic chemicals are really essential to product performance. We've got safer alternatives we could be using. There's a lot of hesitancy towards change. A lot of companies are like, it works. We're going to keep selling it, right? A lot of people are like, this is what I've always used. I will continue buying it, which means it stays on the shelves. All of the chemicals I talked about, they're posing these unnecessary additional hazards, but we don't have all the research that we would love to have to sort of very clearly sort of link all the dots, prove how these hazards are harming people. And what happens is that manufacturers are using this process called risk assessment, and they do these risk assessments, which tell them that their products, they'll recognize that, okay, this is a harmful chemical in our product, but the exposure you're getting from the use from my product, it's not going to harm you. It's not, it's not enough exposure to give you harm. Now, these risk assessments, they are kind of guesses based on guesses. There's so much data we don't have. There are many factors that are not being considered when they do these risk assessments. We really need to be asking not like, how much of a dangerous chemical can I use before I get sick, but why am I exposing myself to this dangerous chemical at all? Right? Why aren't we just using something that's inherently safer than using these dangerous chemicals? So I think that's kind of, where we really need to go with cleaning products. We can do better. We should do better. There are ways to keep, our homes and houses clean without the chemicals, especially the ones I've been talking about today. So I think that might be my last slide. I might turn it back to Jayla.
Yes. So we'll take a little breath, everyone. I know that's a lot of information, but I think a good reflection with all of that information is, that being said, so taking into account who is using these cleaning products, which are all of us in some way, shape, or form, right? And what is in our cleaning products? Whose demands should cleaning product manufacturers prioritize? So feel free to enter that in the chat if you feel so called. But for the sake of time, I'm going to keep us moving along to the next slide. And wanted to just share an example of consumer power and how we can use consumer power to drive real change. So this is work that Women's Voices for the Earth has been doing for quite some time. Back in 2007, when we first initially asked companies to disclose the ingredients that were in their products, and it was very clear from their response that that's not something that they were willing to do, especially because at the time there were no laws requiring disclosure. But over the years, we've organized, we've done corporate accountability campaigns, demanding transparency and accountability, and we've seen a lot of change. And so I think the tipping point came in the landmark California law, the Cleaning Product Right to Know Act, SB 258, which requires ingredient disclosure. So that is in the state of California. We would love to see that happen nationally. But all that to say, there is a lot of work that needs to be done, but it is being done by a lot of us that are on this call, a lot of us in this community, and you all can join this work as well. And so I'll move on to the next slide. And so as we wrap up, and we are going to be going into Q&A after this, so get your questions ready. But before we get into that, want to propose some recommendations that I think that we could all use moving forward. So rethink the use of disinfectants, use them only when you really need to, reduce or eliminate the use of fragrance products, as Alex mentioned, consider dry or solid products as when available. Also read the cleaning product labels or websites for ingredients. And we do have a resource at Weave that we're going to be dropping in the chat as well that can help with that and what to look for. Use safety materials such as gloves, eye protection, or ventilation in places that you can. Look for third-party certified cleaning products. You can even make your own cleaning products, which we also have a resource that we'll drop in the chat as well. If you have the capacity to do that, a little bit can go a long way. And which leads me to the next point of don't underestimate the cleaning power of water as well. If you're feeling really empowered and want to make some change on a system level, consider reaching out to manufacturers about concerns that you have. And if you want to stay in the know and see what Weave is doing specifically in this arena, make sure that you're on our mailing list or just in touch with us. And you can do so by scanning that QR code, and that'll make sure that you all are tapped in with us. So next slide, which I believe is questions. Yeah, so now with like the last 10-ish minutes that we have, we will open it up for questions. And I do see that there are a couple of questions in the Q&A. So if you have put them in the chat, if you wouldn't mind just putting them in the Q&A feature, that way we can like keep track of all of the questions that you all have. And hopefully we'll try to get to all of them today, but we do have limited time. So I'm just gonna start us off with our first one, and I'm gonna do a little bit of summarizing. But Linda asked a question, or I don't know if so much of this is a question. Please expand. Oh, I think this was, and this is mentioned when you were talking about essential oils, Alex, but Linda is looking to expand on any educational information that we can share that includes essential oil education in greater detail.
Yeah, no, and thank you, Linda. We've gotten your comments on this, and it's really, it's really very valid, because I think people consider fragrance and essential oils as different things, and we probably need more materials on our website about essential oils, because certainly a lot more work needs to be done. They certainly can have many of the same impacts on people as synthetic fragrances do, and need to be used with considerable caution. So really appreciate you bringing that up, because it is certainly important for people to be aware of.
And then as you were answering that question, someone dropped a question about specifically candles.
Oh.
Like essential oils in
Oh,
candles.
interesting. Yeah, right. Yeah, no, there's been a little bit of research I've seen on candles, which I suppose, to some degree, air fresheners are considered cleaning products, and scented candles can be too. the research I've seen on candles, especially because you're burning something as well, so that's creating pollutants in your air, and then the fragrance ingredients are also significantly released when they're burning. So yeah, it's some people like having candles, but it's basically a way of putting more chemicals and potentially harmful chemicals into your air. So not recommended as a way, if you're looking to, change what your area smells like, you need to be cleaning it and opening the windows rather than burning candles. Yeah.
I'm going to move to the next question. Emily says, there been studies done with humans, like nail salon workers who use quats for utensils, to measure how their exposure impacts reproductive health?
Oh, great question. I love how this sort of links some of the other work that we do, because we also do work with salon products and nail salon workers. Unfortunately, there hasn't been a lot of research on specifically looking at disinfectant use in workplaces like nail salons. And there's certainly a lot of use there. I've done some looking, and quats are very commonly sold in beauty supply stores as disinfectants, and there's a lot of disinfecting protocols in nail salons. Certainly, similar to other, nail salon workers and other beauticians, hairdressers have higher rates of asthma, which you also see with quats exposure, have much higher rates of skin allergies, which you also see with quats exposure. So there's a lot of chemical exposure in a nail salon that could be responsible. Quats are very likely playing a role, and safer disinfectants are seriously needed in places like nail salons. So thank you for the question. It's a really, really good point to bring up.
Yeah, and I think it also touches on the cumulative impact from all fronts. Yeah.
Yep.
Okay, we have another question. It says, is bleach from our homes that are ending up in municipal water supplies being filtered out in city sanitation systems, or is it perpetuating into our faucets?
Oh, interesting. Yeah, there's chlorine bleach in a couple different ways. Chlorine bleach is interesting because when it's concentrated and you've got it in the jug, very, very potent. You need so little bleach to actually get a disinfecting effect because it's so potent. Once bleach is out kind of in the environment, air, sunshine, water, it actually kind of breaks down into fairly safe stuff. So it's not one of those long-term issues. The problem is that some water systems are in fact disinfected with bleach, like, they do water treatment for the water that's coming into your house, and it is chlorinated, right? So it's not necessarily from chlorine bleach that we use as cleaning products getting into our water, like that's kind of going away, but they're intentionally adding chlorine so that you don't end up with bacteria kind of in your pipes and things like that. And that is leading to a whole, I didn't even mention this, they lead to a whole other issue of these chlorinated byproducts, where the chlorine kind of combines with other things, and then it doesn't break down, and it creates these other chemicals which are harmful. So chlorinated water systems are causing issues. Obviously, we need to do something to treat water a lot of the time. There are some different technologies, UV radiation and things like that, which can work in some cases. But so the chlorine in your faucet, there can be chlorine in your water, but it's not necessarily coming from the bleach that you're using in your home. Yeah, but great question.
There was a question in the chat that was in Spanish, and I hope that I am.
Los productos de lavar.
It's about dry cleaning products. I don't know if you have any or know anything about
dry cleaning. Sure. Yeah, we didn't address dry cleaning here because we were mostly talking household. There, historically, there have been some dangerous chemicals, perchloroethylene being the main one, which is getting phased out, which is very good. And it leads to cancer and all kinds of problems. There have been studies of, people working in dry cleaners. So that's definitely been problematic. There are some safer chemicals now, and I don't know too much about them, honestly, what the replacements are. Likely better than perchloroethylene, which is really quite strong stuff and also very polluting to the water. It's a very persistent chemical as well. So, but good question. I did see one question up at the top from Jessica about sort of sanitation in childcare providers, which I think is a really, really good question, talking about, because there are, it often varies from state to state in terms of what you're required to do. If you're, registered childcare provider, there are certain rules that different states have on sanitation, because you're dealing with, a diapering area, particularly if you've got babies in diapers, and there's, all kinds of, hazards that can come from that if things aren't kept clean. This question saying that they're getting pushback about removing fragrance products near the diapering area and having alternatives. It's a tricky one for sure, because you need to keep things clean. I mean, washing hands and even washing with soap is really the best way to go. But I think the best defense here is really information and letting people know why you have certain products removed from the area or not. And letting people know, what you're doing it for and what the potential risks are. I mean, because this is the thing, quats, for example, quats leave residue, right? That, it'll disinfect a surface, it'll get rid of all the bacteria, but then it leaves this residue behind. So if you have something like a changing table that you're cleaning with quats, the next baby that's down there on, with its bare skin is going to be exposed to those quats, and it's going to cause that irritation, right? So you don't want that. It cleans the, it's overkill really for what it's cleaning. So, but it also, with childcare, it really depends on the state in terms of what's required, which is really tricky. There are certainly some states I've seen, and this is also true in food service, requiring chlorine bleach for certain sanitization processes. And so there's a process, to get safer alternatives in there and legally allowed. So.
Thank you for summarizing that question and answering, Alex. We do only have 3 minutes left, and so I am going to move us along just to close us out. And I think some of what we might close out with will be good answers to some of the questions that are in our Q&A feature as well. So if you wouldn't mind going to the next slide. So we've, or let me take a step back. Thank you for attending this webinar. It has been a wonderful experience to see the chat so lively. One of our business partners, Melioria, it has offered to generously donate a raffle to us for those who fill out our evaluation before January 22nd. So after this webinar ends, you will be linked to completing an evaluation for us. And in addition to that, we will also be sending a follow-up email, and we'll have some links to some of the resources that we mentioned throughout the webinar that will be helpful in, for example, making your own cleaning products, or being able to kind of identify where you would like to buy safer cleaning products from. And so we will definitely send that out to everyone as sort of a way to kind of wrap up this webinar series today. Next slide. Please continue to support Weave's mission. If you enjoyed what you heard today, want to hear more, support our work through donating. And if you would like to keep up to date with what it is that we're doing, you can follow us on Facebook and Instagram, where we're always posting more information, different campaigns that we are involved in, and other resources as well. So just wanted to say thank you everyone for coming to our webinar today. Sorry that we couldn't answer all of the questions, but I'll also make sure to leave a link to, I know, my email address, and Alex, if you want to leave yours in the chat as well, if you would like to follow up with us more one-on-one. Thank you everyone for coming today.